So, what we are discussing today is regarding the some topics which were remaining in our previous classes. So, this is about the gastrointestinal disturbances or gastrointestinal disorders, mainly about diarrhea, peptic ulcer, liver diseases. So, about the gastrointestinal disturbance, please keep quiet. It is the diseases or disorders affecting your gastro. Gastro means stomach and intestine. So disorders or diseases affecting either stomach or intestine is called gastrointestinal disturbances or gastrointestinal disorders. Because our gastrointestinal system, that is our stomach and intestine, they have a very important role. They are mainly concerned with the digestion of the food, absorption of the food nutrients, then excretion of the waste material. These three vital processes are actually carried out by our stomach and intestine. So any kind of problem or any kind of disorders which are affecting our stomach or intestine will have an impact on our digestion, absorption as well as on our excretion. So here we will be discussing some of the major diseases. The first one is the diarrhea. What is diarrhea? Everybody know, because at least once in your life, almost everyone will be having diarrhea. So diarrhea is the frequent passage of loose watery stool. That is known as a diarrhea. Now it can be either acute or chronic. Acute means sudden. Sometimes after having a hotel food, people suddenly have a acute diarrhea. So that is known as acute diarrhea. But sometimes people will be having chronic diarrhea. Chronic diarrhea means a diarrhea that is continuing for several months. That kind of diarrhea is known as a chronic. And most of the time, this diarrhea will be caused by different types of microorganisms. Some are viral diseases like rotavirus and norovirus. These are some of the most common type of virus which are responsible for viral diarrhea. Then we have different types of bacteria like E. coli, Salmonella, Shigella, etc. They are also responsible for bacterial diarrhea. Then parasitic infections like hookworm, tapeworm, etc. They also cause different type of gastrointestinal diseases, mainly Endemoeba histolytica. It is a type of protozoan. Then Giardia. Giardia is also another type of parasite. So these are some of the important type of gastrointestinal diseases which are caused by either virus, bacteria or parasite. Now another kind of disease is known as a food poisoning. For example, inflammatory bowel disease, Crohn's disease and ulcerative colitis. Ulcerative colitis means these people may not be able to eat everything. If they are having some slightly different type of food, immediately they may have a diarrhea. Because their stomach and intestine will be highly sensitive. So if they take a hotel food, immediately they may have a sudden diarrhea. So that kind of problem is known as ulcerative colitis. Then and similarly irritable bowel syndrome. Irritable bowel syndrome and this ulcerative colitis are sometimes very similar to each other. Then malabsorption syndrome. Some people may not be able to absorb certain food ingredients like lactose. Then they may have this kind of problem. So these are the different categories of diseases. Some are causing diarrhea mainly because of bacteria, virus or parasites present in the food. Another type is because of some problem with the structure of the intestine or structure of our stomach. They are coming under the irritable bowel syndrome or malabsorption syndrome, etc. Now here in whatever case, almost all diarrhea will be characterized by frequent loose or watery stool. Water stool means our fecal matter. Second thing is that dehydration. If too much water is going from our body, that will be resulting in what is called less water in our stomach, in our body. That situation is known as a dehydration. Then another problem is that when a lot of water is lost from your body, sometimes especially if you are having a frequent diarrhea, there will be abdominal pain. This abdominal pain is actually because of the muscular contraction which are happening in your stomach and intestine. That is responsible for this abdominal cramps. Cramps means irregular sudden contraction is known as abdominal cramps. Then nausea and vomiting. Nausea means in Malayalam we call okana. And vomiting, you know what is it. So this is the problem with diarrhea, etc. Then sometimes if there is, it is caused by any kind of virus or bacteria, that will be responsible for fever also. So these are some of the symptoms which are associated with the most of the diarrheal disease. Then what we can do in case there is a diarrhea. The best, there are different types of treatment methods are there. You might have heard about ORS, oral rehydration solution. So oral rehydration therapy means mainly we will take a glass of water and we put some salt and we also put sugar in that, and that is known as the ORS. Advantage of ORS is that will be able to replace or replenish what the salt and sugar which are lost from our body, because our body needs a lot of salt, especially sodium and also glucose. If there is frequent diarrhea, lot of water will be lost. Along with the water, lot of glucose and lot of sodium ions will be also lost. Lack of sodium in our body can create a lot of problems, because sodium is mainly responsible for maintaining our pressure. So if there is a decrease in the amount of sodium, that will be creating a lot of complication, including low blood pressure. And second method for treatment is that, for example, if our diarrhea is very mild, for example, after 2-3 times it is okay, then you can take ORS. But if it is continuing for more than 1 day, then you have to immediately take the person to hospital, because a lot of water might have gone from the body of the person. Then we have to start antibiotic therapy. If the antibiotics are responsible for bacterial diarrhea, we have to kill that bacteria. But if it is caused by viral disease, then antibiotics may not be very helpful, but still there may be other supportive treatment. Then probiotics. Probiotics are some kind of like a curd. They can replace or restore the beneficial bacteria which were living in our gut. So when a bacterial diarrhea or viral diarrhea is happening, what happens is that they will be destroying most of the useful or beneficial bacteria which are normally present in our stomach and intestine. So to replace, so after a diarrheal incident, we can give the person a lot of probiotic food substance like curd, etc. Because people who are daily eating lot of curd are normally living longer, because there are in many countries of the world, especially if you go to certain areas of Russia, etc. There people are consuming a lot of curd, and curd contain lactobacillus bacteria. They actually are probiotic. These are increasing the advantage of this curd is that they will be replacing our gut bacteria, and more beneficial bacteria like lactobacillus will be there. Then modification in our diet, avoiding dairy. For example, some people may not be able to tolerate lactose in the milk. So if those people are drinking a lot of milk, that will be creating problem for them. So that is known as a lactose intolerance, and these people should not take milk or milk products. So that kind of diet modification can also be done in the case of the diarrhea. For example, some people may be having this kind of problem, irritable bowel syndrome. If you have to identify what type of food substance are mainly creating this irritable bowel syndrome, then we should check, then try to avoid that kind of food. So that is what we can do in case of this irritable bowel syndrome. It's a major problem affecting many people. Then go to another type of disease is known as a peptic ulcer. Peptic ulcer means, I will show you how a peptic ulcer is normally appearing, because it is actually injury. See here, this is what is happening here. There may be some pictures maybe here. So in every peptic ulcer, see here you can see that this is the peptic ulcer. So this kind of problem will be there. So inside the stomach, on the wall of the stomach, some kind of injury is there, and that injury may be sometimes caused by bacterial infection, or sometimes maybe due to other reasons. So that is known as a peptic ulcer. So it's an open sore in the stomach lining or in the upper part of the small intestine is known as a peptic ulcer, and most of the time this is caused by bacteria that is known as Helicobacter pylori. Helicobacter pylori is a primary factor responsible for peptic ulcer. Then there may be other problem. For example, if you are using this NSAID, non-steroidal anti-inflammatory drugs, some of the drugs that we are taking, for example aspirin, etc., they are not very good for, because that have a capacity of creating ulcer. Then excess acid production, because in our stomach there is a hydrochloric acid. The pH of hydrochloric acid is nearly 3. So if there is a lot of hydrochloric acid production, especially when we are getting tensed or because of other reasons or mental stress, that can increase the amount of HCl. And another problem is that when you are, for example, by 12:30, most of the time you may be feeling hungry, but you are not taking food till 2 p.m. What happens is that this acid will be remaining in your stomach, and they will be slowly damaging or destroying the inner wall of the stomach, and that can also lead to ulcer. So this kind of problem, sometimes due to bacterial infection, sometimes due to our behavioral problem, sometimes due to smoking. Smoking can create a peptic ulcer. Then spicy food, too much spicy food is also a problem. Then Solinger-Ellison syndrome, it's not a very common type of disorder. I am not going into the details of that. Then another problem is that what happens in case of the peptic ulcer. Symptoms, one is stomach pain will be there, especially when stomach gets empty. So when stomach is getting empty, our acid, hydrochloric acid will be acting on this open sore and will be creating pain. Then nausea and bloating. Bloating means a feeling of having too much gas in our stomach. Then other problem is that there may not be loss of appetite. Appetite means the person may not be feeling hungry. There will be weight loss because the nutrients may not be properly absorbed. Vomiting may be there. Sometimes the presence of blood may be seen in the vomiting. Then black or tarry stools. The color of the stool, normally it is yellowish in color because of the presence of certain bile pigments. It is yellowish color. But instead of that yellow, if we are seeing black color, that is a sign that there is blood leaking in our stomach. So either in stomach or in the intestine. So that is known as a tarry or black stools. So that is also an indication that the person is having some kind of a peptic ulcer. Then what we can do in case of the peptic ulcer, what are the treatment methods which are available? One is proton pump inhibitors, then H2 receptor antagonistic. So this kind of methods are modern methods. Their primary purpose is to reduce the production of HCl or acid in our stomach. Then we have to go for checking the Helicobacter pylori infection. If bacteria is mainly responsible for that, we should control it. We should destroy that bacteria. Then certain type of painkillers, NSAID, and irritating food should be avoided. Then sometimes if there is too much perforation, too much holes like this, we have to go for a surgery and we have to stitch or we have to treat that open sores. So that kind of problem is what is happening in the case of this peptic ulcer, but it's a very dangerous situation if not treated. That can develop into cancer also. So that is a problem with the peptic ulcer. Then we go to another type of disease which is known as a liver cirrhosis as well as other type of liver diseases. Liver is responsible for detoxification, protein synthesis and digestion related functions. These are three main functions of the liver. And the problem with the liver is that if the liver is damaged, then we have only one liver. So if that liver is damaged, what happens is that our body may not be able to produce bile and there may not be any detoxification, and that will result in death of the person, and only cure is the liver replacement therapy. Then liver cirrhosis is a progressive scarring. too much amount of fibrous cells are developing. That is known as a progressive scarring or fibrosis of liver due to chronic damage. When liver cells are not working properly, instead of normal cells, fibrous cells will be developing there, and as a result, liver is losing its ability to function. Different type of complications can arise, especially the main function of the liver, which is production of bile, production of protein, and detoxification of the poisonous material or toxic substance we are taking. None of these functions may not be conducted by the body. Then what are the reasons for liver cirrhosis? The most common type of liver reason for liver cirrhosis is actually the alcohol consumption. I will show you a picture of liver cirrhosis. See, this is what is happening in the case of liver cirrhosis. See, this is a normal liver. You can clearly visualize what is going to happen. First one is a normal liver, and second one is a cirrhosis liver. So this kind of damage is what is happening as a result of the cirrhosis. So it's very so in case of liver cirrhosis, one major reason for liver cirrhosis is alcohol consumption. Too much alcohol, it may be damaging your liver, and that is why most of the time people who are consuming too much alcohol, and they are most of the time dying because of cirrhosis, because the liver may be completely destroyed. So liver cells may not be able to carry out its normal function. Another is hepatitis virus. There are 3 different types of virus: hepatitis A, hepatitis B, hepatitis C. A is very common, especially in many food types. Sometimes because of food contamination, hepatitis A can spread. B is more dangerous. Then out of the different type, and B is one of the primary reason maybe causing for this viral hepatitis. So even if you are otherwise okay, if the hepatitis B is infecting you, hepatitis B is highly contagious, because from a tiny drop of blood it can. That is why it is always, when you go to barber shop or hair cutting center, they may be using this knife. That knife is containing very tiny amount of blood. That blood is sufficient to give you hepatitis B. So that is why it is not advisable to allow people to use the shaving blade when you are in a hair cutting salon. Then non-alcoholic fatty liver disease, NAFLD, that is it is commonly known as a fatty liver syndrome. I will show you how fatty liver syndrome may be appearing. So here you can see that what is a fatty liver. See, this is what is happening in case of fatty liver. See, this is the problem with the fatty liver. See, here you can find a healthy liver, and you can see also a fatty liver. So this is what there is increasing amount of fat cells. So that is known as a fatty liver syndrome. The liver gets more fat. So that is also a problem, fatty liver syndrome. Then autoimmune liver disease. Autoimmune liver disease is that our own immune system will be destroying our own liver cell. That problem is known as autoimmune hepatitis. So when our body or our immune cells are destroying our liver cell, that create autoimmune liver disease. Then different type of genetic disorders are there. Some common are Wilson disease, hemochromatosis. These kind of genetic problems can also lead to certain type of cirrhosis. So this is the problem of the different type of cirrhosis. Now what happens when you have person is having cirrhosis? Normally there will be fatigue and weakness. There is one common symptom, jaundice. Jaundice means when liver is damaged, the bile pigments may not be properly processed, and that will be present in your blood, and that will be responsible for yellowing of your skin or yellowing of your eye. The white part of the eye becomes more yellow. That is known as a jaundice. Then ascites, fluid accumulation in the abdomen. So that is a problem of the jaundice. Then hepatic encephalopathy. That is, brain becomes more filled with fluid that is known as a hepatic encephalopathy. In your museum, you can see some babies, old babies, their brains are very. So that kind of situation is known as encephalopathy. Then spider angiomas, spider-like blood vessels on the skin. So that is known as spider angiomas. So these are some of the problems which are visible in the case of hepatitis. Then what are the complications for liver hepatitis? One is hypertension, especially portal hypertension. Then esophageal varicosis or esophageal varices, that is some veins become swollen. You might have heard about a disease known as a varicosis. In the esophagitis, there is a bulging of the blood vessel. A similar kind of problem is also happening here. Then sometimes these liver cells may develop into carcinogenous cell or cancerous cell, and that will result in hepatocellular carcinoma. So these are the complications which are happening. But the primary reason are two major reasons. One is this hepatitis B. Hepatitis B virus is the main cause of liver cancer. Second one is the alcohol consumption, especially in male. If there is males who are consuming a lot of alcohol, nowadays women are also consuming alcohol. So alcohol consumption can be an important reason for hepatitis. Then sometimes some kind of medication that we are taking can also create problems. So too much of any medication is not always, even if you are taking any kind of drug, whether it's cholesterol drug, blood pressure drug, every drug has its own side effect. So when we are taking something like that, we have to constantly monitor our body for other problems. Otherwise they will create irreparable damage to our liver or other parts of the body. Then sometimes the only possibility is liver transplantation. I don't know what is the present, because liver transplantation is one of the most expensive surgery. It costs 25 to 30 lakhs, some for 5 to 10 years, but that was the cost of liver surgery, liver transplantation. Still it will be very expensive. Maybe anywhere more than 25 lakhs will be the amount of liver transplantation. Then other type of liver diseases, one is hepatitis, inflammation of the liver caused by hepatitis A, B, C, D. Different types of hepatitis viruses are there. Then it can be also caused by alcohol, drugs and autoimmune disorders. Then other symptom in the hepatitis, there is jaundice, fatigue. Already we have discussed that vaccination may be available for hepatitis A and B. For example, if you are moving to certain countries, you may require to take certain vaccines. So if you taking vaccination against hepatitis A and B, if you are traveling to certain area, there is high chance of hepatitis B infection. Then go for fatty liver disease, NFLD. So non-alcoholic fatty liver disease is very common in obesity. So if you are obese and if you are having diabetes, these problems can start. Similarly, alcoholic fatty liver syndrome, that can also happen in case of alcohol consumption. So all these can progress to cirrhosis. So first it is hepatitis, simple liver inflammation. Hepatitis can progress and later become cirrhosis. Then other is the liver cancer, commonly caused by hepatocellular carcinoma. Different type of liver cancers, risk factors are chronic hepatitis, cirrhosis, aflatoxin exposure. So in case of liver cancer, we have limited options: surgery, chemotherapy or liver transplantation. That is what is happening. Then Wilson disease, a rare genetic disorder leading to copper accumulation in liver and brain. So that is known as a Wilson disease, that can create neurological problems. It can liver failure also, tremors, shaking will be there. Then so in case of Wilson disease, what we will be using, we have to remove excess copper from our blood by using certain chelating agents. Another problem is hemochromatosis. It is a iron overload, too much iron in our liver. In case of Wilson disease, too much copper. In case of hemochromatosis, too much iron may be present. That may be causing liver damage, diabetes and heart problems will be there. So what we are doing is that we have to remove the entire blood and we have to supply with the new blood. And that is a possibility in the case of hemochromatosis. Finally, coming to the last part, the liver health is an important thing, because while diarrhea, peptic ulcer are most of the common type of liver, these are all treatable diseases, but in the case of liver cirrhosis or liver cancer, treating them is very difficult. So prevention, like healthy diet, vaccination, avoiding alcohol, and early diagnosis, all will be playing an important role in keeping our liver healthy and safe.